Hey everyone, I'm Dr. Ebin Jose, an interventional radiology resident, and today let's dive into one of the most important questions MBBS student faces. That is whether to take up medicine, surgery, or radiology. So I would try to break it down into small topics like lifestyle, passion, work-life balance, workload, and also money. So I think by the end of the video, you will have an approximate idea of what you want to take up in the future. So let's first talk about the kind of person you are. Now you like problem solving, you like being with patient, you like the patient care, and you like reading about all the diseases and learning about all the management. Medicine is what you love. But on the other hand, you like using your hands to solve problems. You like doing surgeries, standing long hours, and in many cases, you will get an instant satisfaction after your case is over. Then you will like surgery. But on the other hand, if you're a little laid back and you want a peaceful life and you don't want a lot of direct patient interaction, but however, you like reading, you want to know about all the diseases and how it manifests on imaging, then you will like radiology. Now let's talk about the work-life balance in all of these branches. So first let's talk about medicine. So in medicine you're going to have long ward rounds and you're going to be closely linked to the patient. You're going to be micromanaging the management every day on what dose we'll keep on, we'll start this new drug or the antibiotic. So you're going to be having a close interaction with the patient every day and the patients are yours for life. On the other hand, if you take up surgery, you're going to have all the above, what you have in medicine. Along with that, you're going to have long operation theater hours. You'll have multiple cases, some will be long, some will be short. So there's a lot more adrenaline, but also a lot more stress also. So if you like this kind of lifestyle, you will find it very rewarding. Now in radiology, it's very peaceful. You're going to have a 9 to 5 and you can actually expect what you're going to experience every day. There is no adrenaline, there is no much stress. You'll have set amount of reportings to do CT, MRI and you do some ultrasounds. So it is basically a stress-free life and you won't be interacting much with the patient. Other than this, if you take up intervention radiology, I would say that is a proper surgical branch. Why? Because half the cases in IR is at night. These are all emergency cases. So you'll have calls in the night. You have to wake up in the night and you have to come do the case. If you have taken intervention radiology, that is after your radiology training. So let's talk about what everybody wants to know secretly. That's money. So I would say immediately after you pass out your post graduation, if you have taken radiology, you're going to get around 2 to 2.5 lakhs per month. And if you are working in 2-3 centers, you can earn up to 5 lakhs per month. So I would say that is about radiology. But if you take surgery or medicine, immediately after you pass out, you can expect a salary of 1 lakh to 1.5 lakhs. And in some place, you can get up to 2 lakhs. But the general trend, if I tell you, is that after few years, let's say 5 to 7 years, all these three branches will come to the same level, the income, whether it's medicine, surgery, or radiology. And it is after the 7 years that general medicine and general surgery people will overtake radiology in terms of income. Because in radiology there is a plateau of income. You don't get more than a level unless you do something else. So after around let's say 7 to 10 years, surgery and medicine people will earn more than radiologists. And in general consensus, surgeons will always earn more than medicine people and radiologists. That is after those 7 years. Because for them it is case based and many doctors work in different scenarios. But I would say in general, surgeons earn more than medicine doctors and medicine doctors will earn more than radiologists after let's say 7 to 10 years. So in radiology, if you want to break this plateau, you have to start your own setup or you have to get into intervention radiology because that is also a surgical field. One thing I would tell you is do not take a branch for the money. Why? Because you don't like surgery. You actually like, let's say, radiology. But you end up taking surgery because somebody told you that the earning potential is much higher in surgery. And believe me, you're going to get that earning potential after, let's say, 10 years or let's say by the time you're 40 or 45. So what will you do till then? You have to maintain your motivation. You have to like what you do every single day. Otherwise, you're going to be disappointed and depressed sometimes. So I would say choose the branch, what you like, what you enjoy. Because if you are good at what you do, the income will always follow. So I would say do not choose a branch for based on the income stats I am telling you or you see anywhere on internet. So when you talk about scope and the future of all these subjects, I would say this is the age of super specialization and you should definitely think of it. I'm not saying it is a must, because you're going to be comfortable if you stick to general medicine, surgery, or general radiology. No doubt about it. But to future proof yourself and to have a better career, I would say take super specialization after this. So if it is after general medicine, you can think of rheumat, endocrine, gastro, onco, and neuro, cardio, etc. If it is after general surgery, you can think of oncosurgery, urology, gastro, neuro, pediatric surgery, CVTS, etc. And if it is radiology, I would say definitely think of intervention radiology, because I think it's a very beautiful branch and it is very upcoming, and the number of doctors in India are very less. So I think that's a great option. But suppose you don't want interventions, you want diagnostics, I would say fetal medicine is a great option. Another one would be musculoskeletal radiology or cardiac radiology or neuroradiology. So don't choose a branch because your relatives told you or your close friends told, because in the end you have to stick with that branch for the rest of your life, let's say 20, 30 years, and work will occupy majority of your time. So you have to genuinely like and enjoy this branch, because you have to find some peace. Unless you have peace, you're not going to be happy. So I would say you are the right person and you have to make the choice. And whatever you want to take up, do put it on the comments. I will give you an honest advice. And another thing is, if you like such videos, do subscribe and share it with your batchmates, because I'll be making few more videos on NEET PG choices, radiology residency, and IR residency in India. Thank you, and I'll see you in the next one.